Macular degeneration is a disease of the macula, or the center of the retina at the back of the eye. The retina is the nerve tissue that lines the back of the eye. Macular degeneration is the most common cause of visual loss in older patients in Australia. There are two main forms of macular degeneration, a dry form and a wet form. We can think of the dry form as being wear and tear of the retina. The wet form is characterized by an abnormal blood vessel that grows underneath the retina. Both dry and wet macular degeneration can affect the vision by causing blurring and distortion so that lines can look crooked. In the dry form, the vision tends to be affected more slowly, whereas in the wet form, the vision can suddenly decline. In both dry and wet macular degeneration, patients may have poor central vision, but they will never go blind because they still retain their peripheral vision. Any patient over the age of 50 can potentially get macular degeneration. We don't fully know what causes macular degeneration, but the main risk factors seem to be aging, genetics, and smoking. We know that patients who have first-degree relatives with macular degeneration are more likely to get macular degeneration, and in particular Caucasian patients are most susceptible. It's very important to try to quit smoking or avoid smoking, as this is also a major modifiable risk factor for age-related macular degeneration. Treatment of macular degeneration depends on whether it's the dry form or the wet form. With the dry form, unfortunately, there's no specific treatment or cure. However, there are things that can be done to try to prevent the dry form converting into the wet form. Most importantly, it's important to stop smoking if you are currently smoking. Secondly, there are certain vitamins that have been shown to reduce the risk of conversion from the dry to the wet form. These include things like Macutech Essentials, Macuvision Plus, and MD Eyes. Please speak to your doctor about the appropriate vitamins. Thirdly, it's been shown that a diet rich in green leafy vegetables and fish is also very useful. Finally, patients with dry macular degeneration should regularly check their vision with an AMD grid. An AMD grid is a screening tool where you cover one eye and look at the grid to look for distortions or areas that are missing. And if you see these, you need to inform your doctor as soon as possible. Currently, wet macular degeneration, the one with the abnormal blood vessel, is treated with medications that are injected into the eye. And this is a group of drugs called anti-VEGF or VEGF. With treatment, in many patients, vision can improve. But it's important to note that this is a treatment, not a cure. What I mean by that is that it needs to be given on an ongoing basis. So initially, patients require these medications once a month. If they respond very well, sometimes we can stretch out the treatment interval up to every 2 to 3 months, but usually patients require lifelong treatment. It's very important to keep up treatment, otherwise, if it's withheld, often the vision can get worse with time. These treatments are given as injections into the eye. Although this can sound very scary to patients at first, please be assured that we first numb the eye so you actually don't feel anything when the treatment is given. Most patients feel much more relaxed after the first treatment as they know what to expect.